Transmitters have 3 times the viral load of non-transmitters. SARS-CoV-2 positive adults between June 1, 2020, and September 25, 2020, were included in the present investigation, excluding those who tested positive for the virus within 8 weeks after the initial positive result. Each patient's nasopharyngeal, throat sample was mixed for all PCR findings. An RdRp and N-gene-specific PCR test was performed in accordance with the manufacturer's instructions to identify the envelope, E, gene and to confirm the presence of ribonucleic acid-dependent RNA polymerase and nucleocapsid, N. For comparison, the court values were converted to copies per milliliter. A total of 683 people were studied in this study. Most of them were diagnosed after the Municipal Health Services (MHS) did contact screening after they had been in contact with a known case. The remaining 27 individuals in the research were ill. The median age of clinical patients was 66 years, while the median age of MHS patients was 30 years. Hypertension, cardiovascular disease, diabetes, cancer, reduced immunity, obesity, and progression to severe COVID-19 were more common in clinical patients. Clinical patients had median viral loads of 2.51 log 10 copies per milliliter, whereas MHS patients had levels closer to 5 log 10 copies per milliliter. This group's median delay in testing was 7 days, whereas the viral load was greater in the earlier group. MHS patients above the age of 80 showed greater viral loads than those aged 60 to 69 and under 50. There was no change in the results of clinical patients, however. There were more viruses in MHS patients who had more than 5 symptoms, as well as those who had a lot of symptoms, than there were in those who had a lot of other symptoms, like mild to moderate symptoms. All of the patients at the clinic had really painful symptoms. Nearly 90% of patients had their risk of spreading the illness to others assessed, and the average number of contacts per MHS patient was higher than the 3 interactions per clinical patient. For the most part, these acquaintances had at least a 15-minute interaction with one another. The SARS-CoV-2 virus was transmitted to at least one person by 40% of the individuals who became infected. At 5.23 log 10 copies per milliliter and 4.65 log 10 copies per milliliter, the spreaders exhibited viral loads 3 or more times greater than the non-spreaders.